Hi, Shelly. Thanks for hopping on with me today. Really excited to chat with you.
Yeah, it's great to meet you.
So tell me about you.
I am have been in healthcare for almost 30 years. So I have two daughters and four grandkids, as you can see those little feet up there, and have been pretty much all sides of the healthcare system. Started up on the hospital side, provider side, ancillary side. My company that I started about 10 years ago provided non-clinical transitional care services to pretty much all swim lanes of the healthcare system. And NaviHealth acquired us about a year ago. And about 3 months into that, Optum acquired NaviHealth. So it's been quite the evolution for the past 12 months in the middle of a pandemic, and also rolling out our services to so many more members that really have those holes that are missing in the delivery system. So it's been really cool to do.
Yeah, congratulations on that alignment. Yeah, and like you said, during a pandemic, that's quite a feat.
Two
Uh,
two weeks. It was 2 weeks after close
oh
the
my
world
gosh.
shifted. So
Well, I feel like that means it just happened because the last year feels like a blur to me. So,
total. Yeah.
well, cool. So you're pretty deep in the social determinants of health space, which, as we know, is currently and constantly evolving.
Big
Um,
buzzword. It's the
a
big
question
buzzword right now.
a question I can't seem to solve. How many social determinants of health are there?
Too many to count. And I think that, everybody has a little bit of a definition for social determinants of health, but I strongly believe that almost every individual that gets admitted into the hospital or has some kind of big health event, regardless if you're a CEO of a hospital or a homeless individual, you have social determinants. They could be episodic or they could be lifelong, but they're basically barriers that are impeding you from taking care of your health process. And there's, again, way too many to count.
Yeah, I laugh because I feel like when I first started reading about social determinants, probably 5 years ago, when they really started to come into the spotlight, there were probably as many identified at that time, probably about five.
Yeah.
And then like I feel like I'm fairly up to date. Then I was reading there's like six, then there's 10. I saw a study out of Canada that was like there's 19 of them. So but they all kind of follow this same general theme, like you said, the reasons that folks feel detracted from health and well-being,
Right.
largely in a social sense.
Yeah.
Um, yeah,
I think when we started almost 10 years ago, social determinants wasn't a word. Now it's the big, or a phrase, now it's the big buzzword, but it just goes back to, again, being the barriers when, especially when people get out of the hospital and you want to make sure that all those clinical things are taken care of. But oftentimes the reason that those are not taken care of is because barriers that are happening in people's lives. And that could be a CEO with four kids in college that has to pay tuition before he's going to pay for his $500 medication. That's a social determinant for that time. Or not having transportation to go to the doctor or get their medications, or limited housing. You could have short-term housing issues where you don't have somewhere to live after you go home from a hospital, so it's not safe. So they just kind of all build up.
yeah, I recall. So I used to work in frontline in the patient transportation industry. I used to work on an ambulance, and gosh, I feel like to your point, how many times I went on a transport, pick somebody up from their home, and they're up the fourth story of a walk up, no elevator, and the social conditions were difficult for that individual, certainly living with comorbidities. And it was of no surprise that we were then there picking up that individual going into an acute care setting, which in that moment of time was the right place for that individual. But I kept thinking to myself when I worked on the vehicle, gosh, there's so many opportunities here to address truly root causes. Maybe share a little bit about your work and what you're doing to address social determinants of health.
Yeah. Our goal is to really provide a whole that I believe actually is still missing in the system today. And whether you're having an event and you're in the hospital or you're just out of the hospital or you have chronic illnesses, most companies' programs are focused on those clinical aspects. And so our goal is that and then some, is to make sure that if you went home at the hospital and you had pneumonia and you need to see your pulmonologist, what else is happening? If you're a senior and you were in a hospital for 4 to 6 weeks, do you have food when you get home? Is all the food that's in your refrigerator spoiled and so that you don't have nutrition to take care of? Do you have the right transportation to get to all of your follow-up appointments or to get your prescriptions? And if not, why? What are those barriers that are breaking down? Medications are a big determinant. Barriers of just not having the education level sometimes to understand the medications that you're taking. You could be taking duplicate, the same medication. One's a generic, one's a brand name. That doesn't often take like a clinician to understand that. We're the cruise director, if you will, of getting them to the right spot and understanding what those barriers are, and then doing everything we can to try to solve them so that they can focus on getting better.
That's great. I'd like to go a little bit deeper into the transportation piece, right? So that's where obviously Roundtrip is hyper focused on that particular facet of the social determinants of health. But I, of course, you know, I think we could probably agree that transportation sometimes affects the other social determinants too. We've certainly seen a lot of care platforms out there, like, the Unite Us, Aunt Bertha, Healthify, NowPow, and others. Um, we know transportation is a social determinant. We know it's crucial for accessing resources to address other social determinants like job training and food bank access and counseling. Where do you see the intersection of rides as part of these social care platforms?
Well, I think it's huge. I think it's still a key thing that's missing. I mean, there's many health plans and health systems that are starting to get really innovative and doing different things to provide and pay for transportation, whether it be Ubers and Lyfts or vouchers for the government programs. And just like you said, it's bigger than just going to the doctor. It's going to fill out an application for housing or financial aid, or going to the DMV to get an ID, because without that, you can't get the other community services that you need. Figuring out how to get all of those options to people is part of the process that I think some of these platforms can help with. And then figuring out who's going to pay for them, and helping the patients with all the follow-up is also a missing link right now.
Yeah, so let's talk about like that follow-up piece, that closing the loop for the vulnerable populations. How does that look? What do you see the future of that? I'll call it care continuum or communication continuum.
I think it's twofold. In a program like ours, we are very high touch. We're touching patients more than 20 times in a 30-day period, to the patient and or their providers or community resources. Some might say like that's too much and people need to build independence, but when you're again in that vulnerable standpoint, it takes a village. And so we're wrapping our arms around them, holding their hand, and making sure that they're getting set up with all of the processes. It could be food, it could be financial assistance, it could be transportation. And oftentimes, we and other companies can't solve the world in 30 days. So having a short-term, high-touch program, I think is critical. And the second piece is, so who's there to give the baton to? Is it back to the health plan, to their care management teams? Is there community providers that then take over when companies like ours stop? Is it back to their primary care doctor to make sure they know of all of the things that were set up to then continue that on? And I think that's a big piece on handing the baton off.
Do you find that a lot of the folks that are ultimately benefiting from the services that we're talking about have largely given up? They've given up on healthcare, or maybe they've even given up on those social services.
So much.
So how do we change that?
Trust and building relationships. Like one of the easiest things, which is not rocket science, but also ends up being part of the secret sauce, is building a rapport with people. The system is so fragmented now, which is all of our faults. But doctors and nurses are overworked and underpaid, and everybody's trying to check their box. When you establish a safe space to have a rapport and a conversation with somebody about the artwork on their wall or the shirt they're wearing, the barriers just come down and they are able to express why they're having those barriers. and regain the trust in the healthcare system so that they'll follow through with things. And we see it day in and day out.
Gosh, I love that. The secret sauce is really just building that trust.
It's
And
key.
I know that only comes with time, certainly with engagement and
Yes.
education. Let me take a hard pivot here to the other side of the model, if you will. So we often see a lot of frameworks out there when it comes to addressing social determinants of health. Certainly in our organization at Roundtrip, we've had a lot of partner IDNs, integrated delivery networks, provider organizations, and others say to us that they're trying to figure out how to interface their EHR with screening options. And oftentimes it feels like they're not even sure where to begin. Where where would you begin? How would you begin to provide guidance to call it a provider organization that's looking to embed an SDOH strategy into their practice or organization?
I think that's a good question, and it's hard, to be honest, because a lot of the strategies out there are quasi predictive modeling tools for social determinants. I don't love those, to be honest. I think they're very they're labeling patients sometimes incorrectly, of looking at race, gender, zip code, which sometimes is a trigger and sometimes is not, though. I believe that it starts with an event and finding out what is happening with that individual currently, whether that be from the EHR, from the doctor's office, the hospital records, but most importantly, continuing to update that. You might only be homeless the first part of the year and not later. So we don't want to then go down a route and treating a patient one way when the things are changing out throughout their life cycle. So I think that that's a big untapped problem that's not necessarily solved yet. There's no really great tools for it. The biggest tool is starting with the patient and taking that information.
That's funny you say that. I once had a conversation with a physician executive that also worked in the financial space. And we started talking about the role of AI in healthcare. And I think we actually went a little deeper relative to social determinants of health. And he said to me, what's your opinion on, he asked me, like, what's my opinion on predictive models, particularly AI, in healthcare at the intersection of SDOH? And I said to him, inconclusive. We're too early.
Yeah.
Uh, and I said, sometimes I think a lot of people throw out buzzwords like AI, and even I sometimes fall into the trap of really looking at how do predictive models appear with social determinants of health and transportation. Maybe we can begin to tie the two together. Um, I think that catches the eye and the ear of a lot of people. I also know, as has certainly been proven time and time again, healthcare is 10 years behind.
Yeah. Not
Many
more.
organizations we're talking to are still just trying to find access to rides. Like that's about it. That's it. We're still at the bottom of that Maslow's hierarchy of needs pyramid.
Yep.
Um, where do you see us present day? Like where are most organizations in their understanding of the populations that need to be served?
I think you hit the nail on the head that we're maybe more than 10 years behind. I mean, there's definitely those out there that are pushing forward and get in. I mean, data is power and knowledge, and a lot of health plans and health systems love it and will act upon it. And some don't have the bandwidth to react to it. So it ends up sitting on a shelf. There are several health plans and health systems and organizations across the country that are taking feedback from data like ours. It will show you, here's why your patients are getting readmitted. Did you know that half of them didn't have rides to their doctor's appointments? Or did you know that the doctors that are sending patients home without home health, those are all the patients that end up getting readmitted? Or here's all of your DME companies who are not showing up with oxygen on time. They're taking that information and making changes so that the system can work better, but not everybody's using the data because they just don't have the resources, or it's so much you just don't know what to do with it.
It's so much data that they don't know where to begin. I feel like
Yeah.
I hear that so often with provider organizations. The data is exciting, but data isn't useful until it's mined and made into information that can be
Yep.
actionable. So let me go back a little bit. So, really excited about your alignment with NaviHealth. Would love to hear where you see that go. Would like to hear a little bit more about, where's that going? Where do you see, NaviHealth taking the social determinants of health offering, particularly when it comes to payers, providers? Which customers do you think will benefit the most? I'm really excited to hear more.
Yeah, I mean, I think that that's why they acquired us. You know, Clay and I were very like-minded on starting companies that were out to do something different and really help people. So historically, we serviced a lot of different members, both self-funded, Medicaid lives, Medicare lives, as well as fully insured. NaviHealth's core mission is more focused on the senior population. So we are still serving some of those populations that I just referenced that we brought over with our legacy block of business. But going forward, we are really growing with Medicare lives. We've already rolled out in several states in the past 12 months and compounding our services onto NaviHealth's core service around the post-acute state, as well as many dialogues with clients, health plans, and hospitals for just the patient navigation solution. So really touching those members when they're admitted into an acute setting with a non-clinician to establish a relationship and say, hey, Mark, I'm Shelli. I'm going to be your person when you get home, and I'm going to be there for whatever you need. When Mark goes home, I'm your person for 30+ days. I'm making sure you get your medication. Your home health nurse comes. Your DME gets delivered. Your medications are there and you know why you're taking them. Plus that you have food in your house and you're not having any other barriers. So really wrapping all of that up with a bow as much as we can in that 30-day period to make sure that Mark is set up for success going forward.
Oh, I'm so excited. I tell you, I feel like I'm finally, if I could be so bold, I feel like I'm finally seeing value-based care come to life. I feel
Yeah,
like we've been talking about value-based care for a
ever.
long time. And through our organization and certainly through your work, but even firsthand, I have now seen plans, particularly Medicare Advantage, like you've outlined, say we are willing to get behind programs that ultimately are more root cause driven and mitigating, and frankly, staying proactive on those opportunities, because we all know that particularly vulnerable populations being in the wrong care setting is not the right place for them. Short term, it's expensive for the system, obviously, and ultimately, not the right place for that individual, for them to get to the betterment of health and well-being.
Right.
I've seen now health plans now say we are willing to fund rides to go to social services, again,
Yes.
particularly for vulnerable populations, when before it was like, how do we reduce access to rides because rides are an expense? And now it's like, wait a minute, rides are cheap. It makes all the sense in the world for folks to get to these social services, so that they get to the betterment of health and well-being, particularly where the gaps in society have left them in a lurch. I'm particularly excited. I wanted to wrap up by saying thank you for the work that you've done. You continue to do, your team does. Certainly as a NaviHealth partner to Roundtrip as well, I see so many opportunities for us to be working together. And I look forward to cheering on your continued successes.
Oh,
Thanks
cool.
again.
Well, thank you.